and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. I'm delighted to introduce my guest today, Dr Anita Suleiman. She's the president of the College of Public Health Medicine at the Academy of Medicine Malaysia. She's also the former director of the Disease Control Division at the Ministry of Health, and she has been widely credited as the architect of Malaysia's PrEP program. PrEP, which stands for pre-exposure prophylaxis, which is medicine that can be taken to prevent getting HIV infection. Dr. Anita, thank you so much for being on the show with me today. I'm glad to talk to you. So let's talk about PrEP. Maybe you can begin our conversation today telling us a little bit more about PrEP and what gaps it fills, specifically in trying to address our public health efforts to end the HIV/AIDS epidemic.
Okay. Thank you, Melisa, for inviting me. Actually, I'm honoured to share with you the PrEP journey in Malaysia from the delivery or healthcare delivery perspective. Okay, so the thing is that at the beginning of the epidemic, we all know that Malaysia predominantly, the HIV in Malaysia predominantly among the people who inject drugs, right? So we could see at the beginning of the epidemic how the HIV cases, went up exponentially, So, and we reached peak at 2002. So that has brought about the implementation of harm reduction, our first harm reduction, which was targeted for people who inject drugs, all right? So and then we were successful in bringing down the HIV by more than 50%, I would say, between 2002 and 2010, right? Because of harm reduction program. So what I want to say here is that harm reduction is not new in Malaysia. Okay. So we were successful. But from 2010 until now, right, the decline trajectory has stalled. We don't see any more decline. But what we are worrying now is that the trend is slowly going up, all right? So we have to do something to prevent the trend from going up.
Do you have a hypothesis as to why it stalled?
Yeah, definitely. Because if you look at HIV in Malaysia, at the beginning, it was driven by people who inject drugs. We were successful in bringing that down. Now we only have 3%, less than 3% of cases, HIV cases contributed by people who inject drugs, compared to previously used to be 70 to 80% at the beginning of the epidemic. But now, from 2010 onwards, the HIV epidemic has changed the landscape, right? So it is predominant now among sexual transmission HIV. As you know that tackling HIV, sexual transmission HIV, is not easy, because it carries with it the taboo, the religious and cultural norms with it. So people don't want to talk about sex openly. So we found that it is much more difficult to educate people to use condom persistently, for example, because even condom is a taboo. People are not supposed to talk about condom freely because we will be seen as supporting or promoting extramarital sex, for example. So this thing has been going on and on for, I think, since 2010, and we are not seeing lights at the end of the tunnel. Okay. So this is where PrEP plays a role in bringing down the HIV, especially among sexual transmission group.
Okay. So PrEP is a form of harm reduction, and it's been kind of built in or included into the National Strategic Plan for Ending AIDS. So talk to me about how you develop and implement the rollout of the PrEP project in Malaysia.
Okay, now when we talk about PrEP here, okay, pre-exposure prophylaxis is not new, right? So it has been used globally since 2012, right? WHO recommended PrEP to be included as additional prevention option 2015, right? It was about 10 years ago, right? So for us, it took us almost 10 years to really decide to implement PrEP. So before we embark on PrEP pilot intervention, 1 year we have discussion, series of discussion, informal discussion, formal discussion with various groups of people, even with religious group, with the NGO, with academias, you know. So we are trying to dig as much as possible evidence that would be used for Malaysia to implement PrEP. And also we studied on whether the principle of PrEP is against the ethics or Islamic medical ethics or what we say that Islamic ethics, right? So knowing PrEP is so sensitive, it is often associated or being linked to extramarital multiple sexual partners and LGBT. So it is not an easy task to do to implement PrEP because we have gone through harm reduction for people who inject drug, you know, the backlashes that we receive, you know, we are facing the same thing. So we know and we are ready before we embark on the pilot intervention. We have taken that into consideration about the backlash, you know, the sensitivity.
So having taken that into consideration, what then did you discover about the ethical principles that support the use of PrEP? Okay,
now before, because if you look at PrEP, okay, PrEP is a prevention. Right, now we talk about ethics or principle in Islam. It is the duty, it is a duty in Islam is to prevent disease, right? Prevention is a noble work, right? So now before we embark, we have weighed, right, the PrEPs, okay, whether it is in line with Islamic medical ethics or Islamic ethics. So we can see that there are several principles of Islam that we can use that actually align PrEPs. Okay, for the first, I would like to brief here is about preservation of life. Okay, now preservation of life is one of the primary objectives in the Islamic law, Maqasid Syariah. Right. Now here we see PrEP. Okay, PrEP is a medication that we give to prevent one from getting infection or the what do you call it, life-threatening infection, which is HIV. Because once you get HIV infection, you are infected for life. Right. So it is a life-threatening disease. So PrEP is is to prevent that. So it is about preservation of life. So it aligns with the Islamic principle in that aspect. Second is prevention of harm. Okay, now Islam places emphasis on preventing harm. All right, so you know, so this is where PrEP is a role for that. It is preventing one from harming oneself when they get infection, and also harming others who are their partners or spouses from transmitting the disease. So this is in the context of reducing harm or preventing harm, which we see that it is aligned with the Islamic principle. Third is what do you call it? Just, you know, all right, adil, right? So I think in this case, Islam emphasizes the justice and fair use of resources. Now, there are a lot of voices out there, if you recall. People were saying that we agree with PrEP, but it must be out of pocket, you know. This is where prevention, PrEP is prevention, which is should be seen as a public health, in a public health principle. It is a preventive measure. So making it affordable, all right? It is an adil, all right? It is a just things to do, all right? So we cannot say that because these are involving certain group of people, therefore that's the life they choose, so they should be responsible with their life. No, that is wrong. When we say that, I mean, as a public health professional, we extend our preventive measures regardless, right? So we have to be fair, to be seen fair and just in making allocation for HIV, although it involve or affect certain group of people.
So now that you have these principles that align with the use and the prescription of PrEP, how do you involve the stakeholders, the religious scholars, the religious community, to support, to I guess, be part of the success of the PrEP implementation?
Okay, at the beginning of the planning, before we embark on really going down and providing PrEP as a pilot, right? We had, a seminar, for example, to explore the understanding of in Islam about taking medication and preventing one, from a dreadful disease. That is to include the condom use and also PrEP, whatever it is. Okay, so we also have a series of roadshow with a group of state religious, mufti officers to explain to them what Ministry of Health is trying to do with PrEP, why PrEP now, what is the importance of PrEP. So we give them all reason and justification why Malaysia need PrEP, So although we don't, until today, we don't have a unified fatwa as yet, but Ministry of Health activity or program is based on sound public health principle, with or without the fatwa. But I think if you look at the trend of opinion from the Muslim scholars, we don't have a mufti or what we call fatwa from other states as yet, except for PrEP.
Yeah, PrEP.
Except for PrEP,
okay,
right?
Came up with
so
a fatwa.
PrEP came up with a fatwa. We had a discussion with PrEP team, PrEP mufti or office team before, trying to make them understand the reason why PrEP is there. PrEP is not endorsing the behaviors that are prohibited by Islam. PrEP is to prevent disease. That first thing first, prevent the disease, right? Because if you don't prevent them, one can get a life-threatening disease, and that is again prevention of harm, preservation of life. That is responsibility or a principle in Islamic ethics.
Okay, so if I understand correctly, Perlis State Fatwa Committee said it is permissible, harus, for health practitioners to administer PrEP in the aim or the niat of preventing HIV transmission.
Yes.
Okay.
Yes.
And that must have come at that must be important for healthcare providers, particularly because you want to see PrEP implemented at primary healthcare level.
Exactly.
Yes? Okay.
Yeah, because I think that is where the role of religious scholars plays in ensuring PrEP delivery reach the targeted people, and we will be able to prevent HIV infections in the future. So although we don't get other states fatwa coming out, but I think at least fatwa from police enlightened, at least lift up the burden, among the healthcare providers, mostly the Muslim healthcare providers, because I know that I'm very clear with our principle with public health, but the providers sometimes they are in between, so they are not sure whether are they promoting or not, and things like that. So the fatwa from police actually helps us a lot.
Yeah, okay.
Allay our what do you call it?
Doubts or concerns.
Doubts and concerns about providing PrEPs, if not providing PrEPs, talking about PrEPs, educating relevant or or specific people or group of people about PrEP, the risk and benefit. At least that the best thing that healthcare provider can do, to give the options and let them make the informed decision.
Okay, so if I understand correctly, part of the roadmap is to integrate PrEP into primary healthcare by 2025.
Yeah.
Is that right? Okay, so that's a target.
That's the target.
Where are we now? What's the current progress?
Okay, I left the service May 2024 this year. All right. So I know that there are works already ongoing. Okay, in the pipeline to get approval from the decision-making bodies at Ministry of Health. Right. So the 2023 PrEP was a pilot intervention. Okay, it's a pilot intervention. Is to give us some data to support for us to see whether the uptake are there people going to come to Ministry of Health clinics, because coming to government clinic always being associated with stigma and discrimination, you know. So we want to test the public or those people who really need PrEPs, whether are they coming to Ministry of Health clinics or not, if we were to provide it, right? So because previously, you know, there were perceptions saying that the key populations will not come to Ministry of Health or government clinics. They will rather go to private sectors, right? But we tried out that 1 year, to our surprise, right? To our surprise, we reached more than 3,000 in a year, all right? So although we only open up at selected clinic because it was meant for a pilot intervention for us to study the uptake and the acceptance of our primary care providers, all right, on PrEP delivery, right? And apart from that, we also want to see whether PrEP can prevent transmission or not, like what has been claimed by other studies globally, that PrEP can prevent up to 97%. All right, so we
97%.
Yes, up to
HIV
97%. But in Malaysia, all right, so if not mistaken, within a year of implementation, those who really seroconvert is less than 5%, less than if not mistaken, is 0.02%. So we were able to sort of prevent almost all HIV infection if one adhere to PrEP medication. That is one. The second concern of the public is that PrEP is perceived as promoting the prohibited behavior, and they are, you know, people will be indulging with multiple sexual partners, not putting on condom, things like that. But it's not so in Malaysia. It's not so. Because in Malaysia, not only we prevent HIV with PrEP, we were able to prevent HIV with PrEP. We also see the changes, positive changes in behavior. Majority, I think more and more key populations who are taking PrEP are actually engaging with less risky behavior. Those percentage who adhere to one partner only is increasing, right? Right? So in a way, multiple sexual partner behavior is going down, and STI. Okay, at the beginning of the study, we detected a certain proportion with STI. So over the year, all right, STI came down.
How does PrEP prevent STIs?
Okay, when PrEP is I would say, is a space and opportunity for us to educate the people. They come to you because of PrEP, and that's the opportunity, a platform for you to educate them about the risky behavior. I think you'll be surprised that some of them did not even realize that they actually engage with high-risk behavior. Then they change their behavior, so they don't need PrEP anymore.
So positive behavior change through the use of PrEP?
Yes, because we are not just giving PrEP, this is PrEP, you take it and you go back. No, it is tied up with the psychosocial support and then counseling. All right, we teach them about the risk of taking of the behavior.
Because once they come in, they then get the support and then the counseling and the advocacy.
And we teach them, we inform them about the need for condom. They are protected from HIV with PrEP, yes, but they are not protected from STI. So they still need to put on condom. So this is, to me, the way Malaysia model is entirely different from the Western model. All right. So in fact, when we have discussion with, I think, Johor religious group, right? We actually invited religious scholars or religious department to help us with the psycho-spiritual support, because here they come for PrEP. So you have a platform. If not, they will not come to you. They will not appear to even health clinic. They only appear at the late stage of disease, when they're already AIDS level or at AIDS stage, which is no turning back, all right? It's too late. But now we are catching them much earlier. They are not infected yet, but they are high risk.
Okay, so talk to me about what we understand about the way key populations seek healthcare or engage with the public health system. You mentioned that there's a perception that they would rather go to private healthcare. How do you encourage them to get access to primary healthcare providers, public primary healthcare providers, klinik kesihatan, so that they get the benefits of support?
Okay, that's a beautiful question. which I think I missed, all right, the different model of Malaysia, all right. So when we, every selected clinic that are actually implementing this pilot project, we place a PrEP navigator.
What is a PrEP navigator?
A PrEP navigator is among the community. Okay, they are selected, so they are placed at the selected clinic that are providing PrEP. So they are bridging between the community and the healthcare provider, right? So you know what? If you ask anyone, so especially those key population and the young one, they are scared to come. They are scared to come. If you ask about those who are still schooling, for example, tertiary level education, for example, they are scared to come because you know their status might be disclosed and they might suffer rejection or whatever. All right, so they don't want to come. So the PrEP navigator plays a role here. You know, allay the fear that their confidential, the strict confidential is being practiced at every clinic kesihatan that provide PrEPs. All right, and that stigma is not as what they thought previously. I must say that at clinic kesihatan level, stigma among healthcare providers has very much lower lessened as compared to, I think, 10 years ago or 20 years ago.
Wow.
All right, so but people stick to the mind 20 years ago, all right, their experience 20 years ago. So they carry forward. So we want the PrEP navigator to be our spokesperson. So that is why you see that people are coming in. Then the moment, once you get people coming in, more and more people coming in because they realize that the healthcare providers are providing PrEP. They are really, you know, understanding people. You know, they really want to help. They want to prevent infections regardless of who you are. All right.
So that's having PrEP navigators will help bridge that, will help kind of influence them into that direction. So what's the plan? So the idea was to have a kind of pilot intervention, pilot project first to see whether it can work. And there have been astounding findings. So what is the next step for expanding PrEP across the country? How do we scale up the benefits?
Yeah, so this is the next step because I know that the Ministry of Health, especially the relevant sectors or divisions, are already working towards getting a policy, you know, thick at Ministry of Health level to provide PrEP or to accept or to include PrEP as part of prevention option, all right? So again, papers, I know that before I left, papers already submitted to get the first level, which is the policy level at Public Health Division. So once there is a yes at that level, it will be accelerated up to the Director General level. So once it is, you know, it get presented to Director General or DG's level and get a yes, then the final will be at the Secretary General level because the dollars and cents, right? So it is at the KSU or the Secretary General levels to approve whether to approve all or to approve part of it. Okay, so I envisage that by 2025 or at least not later than 2026, more and more clinic kesihatan or health clinics will be able to provide PrEP, you know, to those who are in need, especially the B40. Okay, at the same time, I also envisage that more and more private sectors are willing to provide PrEP. But those who can afford to pay, I mean, they can go to private sectors. But those who can't pay, especially the B40, right? We have to help them, and they come to our government health clinic. All right. So we hope that Malaysia model is not just about giving PrEP, but coupled with counselling and psychosocial, psychospiritual counselling will be a model for Islamic countries.
Can I ask you, in the minute or so that we have left, what you would like our audience to take away from this conversation? What would you like them to understand about the journey of PrEP in Malaysia?
All right. So I would say that my last message, all right, before I, go. AIDS is not over. Okay, AIDS is not over. Okay, and it's getting nearer. It's getting nearer and nearer. All right. So what we understand that abstinence is still the best. Okay, we don't deny that abstinence is still the best because it prevents one from getting infection, HIV as well as STI. But if abstinence is is not doable or has failed, right? If abstinence failed, so condom is a way to go. So we want the public to not to label or to instigate to those who actually needing PrEP or needing a condom to protect themselves. At least, you know, what the public can do is teach your children about abstinence, because abstinence is not the responsibility of health clinics to provide. Abstinence is the responsibility of everyone, starting right from the home. It's the responsibility of parents, responsibility of teachers, responsibilities of everyone in the community. No? Because abstinence has failed, PrEP has to be in.
Okay.
All right. Thank
Dr.
you.
Anita, thank you so much for being on the show with me today. I appreciate your time.
Okay, thank you.
That's all we have for you on this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching and good night.